I'm Maria Lourdes A. Vega, but people call me Didi for short. I'm the Chief of the Nutrition Policy and Planning Division of the National Nutrition Council in the Philippines. The National Nutrition Council Board, or the policy-making body itself, has been chaired by the Department of Agriculture. But in 2005, and then briefly for a year by the Secretary of Social Welfare and Development. But in 2005, the President of the Philippines said the NNC is better led by the Department of Health. And consequently, the NNC Secretariat, which I am part of, moved from the Department of Agriculture to the Department. So for SOLVE Organization, the NNC is the policy-making and coordinating body for SOLVE Organization programs. For mandatory food fortification, the recently passed law on the first 1,000 days assigns the NNC to coordinate and to facilitate interagency budgeting and planning for the first 1,000 days. But all along the role of policy formulation, program planning, and coordination. The Philippine Plan of Action for Nutrition is actually formulated every 6 years when we formulate the Philippine Development Plan. For the Philippine Plan of Action for Nutrition 2017 to 2022, we had the assistance of a consulting group we call Alcan's Consulting International that was engaged through the support of Nutrition International using support from DFID as a Sun Movement country. And the group of Alcans led by Ces Adorna really facilitated a lot of the processes of putting people together, making everyone understand the nutrition landscape in terms of the nutrition problems and what are being done, what's not being done right, what can be done better, and also conducting more focused discussions with specific agencies. And we make sure that what's in the Philippine Plan of Action for Nutrition is also part of the Philippine Development Plan for the same time frame. So that it's not a standalone plan, but it's also part of the bigger development agenda. With decentralization, local government units play a very important role because they decide on their priorities for development in their respective areas based on their assessment of the situation. Therefore, we have always considered LGUs, local government units, the governors themselves and the mayors as important partners. And with NNC, even before devolution, we've already enjoined local governments to organize their local nutrition committees, which are interagency in nature, which are chaired by the local chief executive, so the governor or the mayor, so that they can plan their nutrition action plans based on the situation of the local governments. Therefore, we have institutionalized over the past years a system for local nutrition planning and a system for also monitoring local level plan implementation. The call now is to make sure that local government units actually put budgets for nutrition in their local budgets because they decide on how they will use the resources that they are able to, that they receive as part of the internal revenue mechanism. LGU, local government unit mobilization for nutrition outcomes is one of the enabling programs of the Philippine Plan of Action for Nutrition. It has, that particular program has 4 components. One component is conducting planning workshops with local government units. The second is advocacy with local chief executives so that they will champion for nutrition in their local levels. The third component is on following up continuously following up local government units and providing technical assistance as may be needed. And the fourth is developing a training or a capacity building program for local chief executives so that they become effective nutrition managers. Now, the idea for the local nutrition planning workshops is for the local nutrition community to determine what their problems are, what they will do about these problems, but also identify how these concerns will be part of the bigger development plan. Then there is the comprehensive development plan that's done by all cities and municipalities. There, each city municipality defines its own unique development agenda that should also be contributory to the direction set by the provincial development and physical framework plan. And after that development plan, the LGUs are supposed to develop their local development investment program where they say, okay, I want to put up this program and I'm going to spend so much in this. And finally, the annual investment program. The idea conceptually is if it's not in any of these plans, it cannot be budgeted. That's right. That's why we've been investing time and money to go around the local government units, conducting these planning workshops, bringing together health, nutrition, one more sector, and the development planning group so that they can together evolve a draft plan that can be approved that will be eventually approved by the local chief executive and the local nutrition committee for integration and inclusion in the development plans. So that's right now, that's what we're doing. And we're hoping that we would really get a higher increase in budgetary support from local government units for nutrition programs. This effort is particularly helped by a national level issuance that tells local government units that okay, this is what your allotment for the following year is, and these are the priority programs that you can consider for programming. And that has included for the past 2 years nutrition plans or nutrition programs as integrated in the local nutrition action plan. That is an important input to facilitate the uptake of local government units. Funding nutrition programs in the Philippines is largely coming from government coffers through a national and local budgeting system. So nutrition is most of the nutrition expenditures and investments are really in the Department of Health or the health sector, and the investments have really increased over time. So now there is money. There are funds for the management of acute malnutrition, the requirements for micronutrient supplementation, iron, vitamin A, and micronutrient powders are the full requirements of the country are provided for under the health budget, and as well as limited promotion along infant and young child feeding. The National Nutrition Council budget, while we are a coordinating body, includes budgets along nutrition promotion, and we have a budget to assist some local government units to scale up some of their nutrition programs. The Department of Agriculture would have programs and projects to improve food supply, improve productivity of farmers. But more of it should really be focused on the small farmers. And we will see more of those programs in the next 3 years. The other departments the Department of Social Welfare and Development has some about 4 billion pesos, Philippine pesos, for supplementary feeding of children in daycare centers. The same thing with the Department of Education and Culture, Department of Education, that has funds for dietary supplementation of wasted school children. And the investment there is about 4 or 5 billion pesos. Philippine pesos. And through all this budget review, we've always said that we are missing the first 1,000 days really in terms of fuller investments in all the possible interventions, including dietary supplementation of these groups. Our challenge is to be able to determine exactly how much local governments have invested for nutrition. The best that we try to do is to develop some kind of a template that will help them identify what budgets they will use along specific activities and interventions along the programs and projects of the Philippine Plan of Action for Nutrition. So our efforts for the coming years is to evolve a system by which we can capture actual nutrition expenditures both by the local government units and the non-government community. The main challenge really is to mainstream nutrition as a concern in the different sectors and in different local government units. And so that with that mainstreaming, we need to get support from the highest leadership, both in the country and in the particular sector, and to make sure that the nutrition perspective permeates not just the people we usually interact with, but it's part of the policies and the programs. It's a concern of the policies and programs being adopted by the particular sector. And to making that happen is really a challenge because, of course, everyone has its specific accountability, specific mandates, and so we should work together so that the integration of nutrition concerns becomes a mandate enhancing perspective more than a burdening one. I think that's the main challenge. The other challenge is, of course, adequate investments for the different nutrition programs. And it's not just in the department, in the national government, but more at the local government units. And the third challenge is evolving and capacitating systems and human resource so that even if I'm an agriculturist, I will have a nutrition mindset, or if I'm a social welfare a social worker, I have that nutrition mindset together with my basic sectoral mandate. Also, especially among the health sector, how do you relate with the mothers themselves so that we are able to support, not teach, but really help them adopt the behaviors that we are saying are good for nutrition, particularly exclusive breastfeeding and giving right complementary foods at the right time, in the right way, in the right nutrient density, in the right frequency. And how do we help other sectors to converge their services in the families, especially those with members of the first 1,000 days? The Philippines joined the Sun movement in 2014, and this was not a joining that was decided by a single agency like us. It was actually the subject of discussions in the NNC Technical Committee, which is an interagency committee. We were the 50th or the 51st country to do so. And since then, we keep on asking ourselves, how has the Sun movement helped us improve things? First, the principles that the Sun movement talks about are not new to the Philippines. They've been the rallying cry ever since 1974, talking about multisectorality, convergence of action, being accountable for certain commitments and all of these things. But the value that we have seen in the Sun movement is how we are introduced to tools and processes that help us look into ourselves better and try to improve scaling up. And particularly the Sun joint assessment that's done every year has been very helpful in clarifying exactly what we mean by multisectorality, what we mean by convergence, what we mean by proper investments. And we've done, I think, 4 or 3 assessments, and then the concept of movement, the concept of multisectorality becomes clearer, and even the roadmap for this, the Sun movement becomes, oh, okay, that's why, that's how it's framed. We've always looked forward to the participation in the Sun movement, in the Sun Global Gathering. First, excited to put together the Philippine delegation because then we can bring in more people into the Sun movement. We look forward to planning for the marketplace that's now called the village or something. And we look forward to putting together what we can share to the global, to the community, to the other Sun countries in terms of what we've done in the Philippines, and also go around and share and learn from what other countries are doing. We look forward to the different sessions, the technical sessions, and we look forward to be part of those technical sessions as a panelist to share, for example, how we were able to work on on the taxation of sugar-sweetened beverages, on how, particularly for the past years, we've had success in having the legislators pass many legislations that are very contributory to nutrition, to the first 1,000 days, universal health care, poverty alleviation, and conditional cash transfer. I think that's a whole experience that can be shared by the Philippines.